Ambulance, paramedics, and EMTs have been on the front lines in the fight against COVID-19. Nakaya Carrero tells us how one rural ambulance service is pushing forward and doing their part.
It's not just the big hospitals facing big problems. The Kidder County Ambulance Service takes care of a more rural part of the state, serving 6 communities, and they say it's bad.
And then come fall time, where we started to see this really big increase in calls, it's kind of gotten a little bit overwhelming.
During the last 2 weeks, they have seen an influx of calls and say it's beginning to take a mental and physical toll on their staff.
The one thing that I did tell them just a few days ago, if they become overwhelmed, they just need to let me know, and I'll take them off the call shift, or we'll have someone else cover their shift, because I'm beginning to see that.
The ambulance service is also responding to more calls that aren't COVID related.
They'll put off their medical condition or putting off getting help in a timely fashion. So some of these patients are much more sick than what I've seen in the past. And unfortunately, I've seen also an increase in the death rate amongst our community members. That is really taking its toll.
Staff have been running nonstop responding to calls, and some calls can take up to 4 hours before they're done.
Usually in most all cases, we will go to Bismarck to transport our patients, but they've been at max capacity on a couple different occasions, so we've had to take patients to Fargo, and Jamestown too.
Reporting for KX News in Steele, I'm Nakaya Carrero.
Thompson says she has also responded to plenty of COVID-19 calls that are from young adults suffering with serious symptoms.